Hello.
Yeah, Smita, you're audible.
Yes. So, ma'am, you can start the session.
So thank you so much, Asmita. So on the behalf of Autoimmune Subsection of Indian Academy of Neurology, I welcome you all to the ECTRIMS Prelims Quiz 2025. So in the Autoimmune Subsection, we have Dr. Rohit Bhatia as the chairperson and Dr. Netra as the convener of the subsection of this subsection, Autoimmune Neurology. So we have the quiz masters today with us, Dr. Preetam Raja, who's a faculty of neurology at NIMHANS, Bangalore. Then we have with us Dr. Ganraj, who is an assistant professor at Department of Neurology, NIMHANS, Bangalore. And myself, I am Dr. Kamakshi Dhameja. I'm a senior consultant in Max Hospital, Vaishali. So now I would request Dr. Ganraj to please tell us the rules and regulations for the upcoming prelims.
So good evening, everyone. So we will start the quiz, and so this is an online quiz, the prelims, and so once this quiz is means you start this quiz, it is a single attempt, and there is no scope for any reattempt, even if you leave the quiz in between. And it is always recommended to use your laptop or desktop because it is online mode and than the mobile device. However, still with the cell phone or with the tablet, you can participate in this quiz. Stable internet connectivity is one of the important thing to consider, and so it is the role of the participants to ensure that they have a very good and stable internet connectivity, and we are not responsible for any internet issues which is happening at your end. And in this quiz, there are total 30 questions, and we have kept 30 seconds for each question. And each correct answer will carry plus 4 marks, and the incorrect response will carry minus 1 mark. And if you have not attempted or if you have not submitted the answer, that will not be considered and it carries 0 marks. And these questions are taken mainly from IA and autoimmune subsection webinars which happened in this year. And as you all know, these videos are available in the YouTube. And if there is a tie among the two participants and one who answers the quiz in the fast and the very less time will be taken into consideration. And there are some tie break questions which are available and which will be used subsequently if required for the tie breaker. And top two candidates are taken for the finals in the ICTRIMS 2025, which will be happening in Bangalore in month of September 2025. So, any doubts or anything for the participants, or shall we go?
I think they are clear, Dr. Ganraj. I think we go
Yeah,
ahead.
I think we can go ahead with the questions. Maybe we can start
Okay.
with question number one, Dr. Kamakshi.
Okay. So you can start with the trial question. So attendees can learn the process of these questions.
Yes.
So we keep only two questions for the attendees as a trial question.
Okay.
So there are a few questions in the chat box. One of them has asked how to answer the question. So you will see the trial questions before we go ahead. It is on this platform only.
The questions will be displayed and you will have to answer. Maybe with trial questions, they will understand.
Yeah. So attendees get ready for the question number one, which is a trial question. You can see on your screen.
So question number one, what are shadow plaques? Option A, remyelinating MS plaques. Option B, they are smaller MS plaques adjacent to a larger plaque. Option C, MS plaques with significant vasogenic edema. Or option D, MS plaques with significant axon loss.
Some are saying they could not see the question.
Questions will be displayed.
No, they are not seeing the question.
So you have to move the screen. So we go back to the trial question number two.
So the question number two, demyelinating lesions on MRI are termed as tumefactive lesions when the size is more than option A 1 millimeter, option B 1 centimeter, option C 2 millimeter, or option D, it's 2 centimeter. You can answer the question live on this platform only. We as panelists are able to see all the questions. If you are not able to see the questions, please check your internet connectivity as well. So trial question number 3, which of the following is the most common initial focal neurological symptom noted by patients who are diagnosed with MS? Option A, weakness. Option B, diplopia. Option C, sensory disturbance. Or option D, visual loss.
Okay, so we're done with the trial question.
Yeah.
So I'm going to do the actual quiz. So attendees, the quiz is the question number 1. Like each question we keep as a 30 seconds. So you have to submit the question.
We'll let you know when 5 seconds are remaining for the question.
Yeah, around 25 seconds, I will announce that 5 seconds is remaining. After that, you will not able to answer the question. I'm going to open the question number 1.
We'll start it.
So question 1. The classical syndrome of bilateral optic neuritis with transverse myelitis was first described and eponymously named after this researcher. Identify him. Is Paul Ehrlich, Wenda Lennon, Eugen David, or Otto Markberg?
Attendees, you have the 5 seconds left. The second question.
So, which of the following MRI patterns of cerebellar demyelination favors MOGAD as a diagnosis? Option A, B, C, or D. These are the MRI images which shows some pattern of demyelination in the brainstem. You have to identify which pattern looks like MOGAD.
Attendees, you are left with 5 seconds. Move to the third question.
So, steroid responsive encephalopathy is associated with autoimmune thyroiditis. All are true for this entity except A, stroke-like episodes. Option B, subacute encephalopathy. Option C, TPO antibodies do not correspond to the severity of clinical deficits. Or option D, men are more likely to be affected than women.
Attendees, 5 seconds remaining. Move to the fourth question.
So, which landmark clinical trial provided us with the pivotal evidence which supported the first FDA-approved targeted therapy against the terminal complement component C5 for aquaporin for antibody disease? Option A, Secura STY. Option B, N momentum. Option C, prevent trial. Or option D, optic guard.
5 seconds remaining. Move to the fifth question.
So all of these MOGAD phenotypes have a high likelihood of steroid dependence, except option A, ADEM leukodystrophy pattern. Option B, cortical encephalitis pattern. Option C, ADEM ON phenotype. Or option D, prominent optic disc swelling during acute optic neuritis episodes.
Attendees, you have 5 seconds remaining. To the sixth question.
So anti-NMDA receptor encephalitis, all is true except it has a new onset neuropsychiatric symptom with prominent dyskinesia, seizures, or status epilepticus. Option B, dysautonomia is common. Option C, it's most often associated with ovarian teratoma in young women. Or option D, IV steroids, IVIG, and or PLEX as a first-line therapy.
5 seconds remaining. So we go back to the 6, 7, 8.
So a 32-year-old female presents with progressive drowsiness. Her MRI you can see, which is the most likely diagnosis here. Either it's MOGAD, aquaporin 4 disease, option C, GFAP, or option D, seronegative demyelination. The abnormalities has been marked here.
5 seconds remaining. Next question.
So the figure depicts spectrum of anti-CD20 molecules which are being developed for CNS demyelinating disorders. The monoclonal antibody, which is marked in a circle, you have to name this antibody. Whether it is option A, rituximab, option B, ocrelizumab, option C, ofatumab, or option D, ublituximab.
5 seconds remaining. Ninth question. Ma'am, you can just read the ninth question.
Clinical trial demonstrated efficacy of satralizumab in reducing the relapse risk in aquaporin, prevent, N momentum, S Ankura Sky and S Ankura Star, and Optic.
5 seconds remaining. Tenth question.
So what is the typical immunoglobulin subclass of aquaporin 4 IgG in NMOSD? Whether it is IgG3, second option IgG1, option C IgG2, or option D IgG4.
5 seconds remaining. Question number 3.
So the association between MS and polymorphisms within the major histocompatibility complex has been demonstrated since 1972. You have to identify the allele which has a primary association with increased susceptibility to MS. The options have been enumerated. Kindly go through them and mark the allele which has an increased susceptibility to MS.
5 seconds. Question number 12.
So the next question, FDA approved drug for NMOSD are all except eculizumab, inebilizumab, tocilizumab, or sertralizumab.
5 seconds remaining. Starting.
So next, a patient presents with vision impairment, hearing loss, and headaches. His MRI demonstrates lesions in the middle of corpus callosum. There are branched retinal artery occlusions as identified on FFA. So what is the most likely diagnosis here? Option A is CADASIL, B is MS, C neurosarcoid, or fourth, so option D, Susac syndrome.
5 seconds remaining. Question.
So the Bugal sign on MRI is characteristically seen in Option A, neurosarcoid. Option B, neurobeshet's. Option C, NMOST, or option D, MS. The MRI has been shown for the reference.
5 seconds remaining. Fifteen question is there.
So the next question, CRMP5 IgG associated optic neuropathy, all are true for this entity except it has a painful bilateral vision loss. It progresses over weeks to months. The most commonly associated neoplasm is a small cell lung cancer. Or option D, autoimmunity occurs before the detection of cancer in about 22/3 of the patients.
5 seconds remaining. Fifteen question.
So BTK inhibitors have been evaluated in phase 3 clinical trials for relapsing MS. All are these inhibitors except evobrutinib, remibrutinib, fenibrutinib, or oralibrutinib.
Attendees, you are left with 5 seconds. 17 question.
So 35 years old male presents with acute myelitis. His MRI is shown. What is the most likely diagnosis here? Whether he has ecocoding for antibody disease, option B, Eales disease, option C, it's a dural AV fistula, or option D, neurosarcoidosis.
5 seconds remaining. Question number 89 is free.
So the next question, LGI-associated limbic encephalitis, all are true for this except it is characterized by seizures, dyscognition features, behavioral changes, and short-term memory loss. Option B, serum and CSF should be tested for neuronal autoantibodies. Option C, it is a normal imaging. Findings exclude the diagnosis. Or option D, early administration of immunotherapy can prevent long-term dysfunction, cognitive.
5 seconds remaining. Question number 19 on the screen.
So which researcher is credited with publishing this landmark study which identified the first pathological classification of MS plaques into distinct immunopathological patterns? The researchers have been enumerated, so mark the one.
5 seconds remaining. Question number 20.
So G5 astrocytopathy, all are true except it has a relapsing meningoencephalomyelitis. There are linear, radial, perivascular enhancement throughout the cerebral white matter. It has a common association, most commonly with ovarian teratoma. And serum positivity alone is sensitive and specific. You have to mark all are true except.
5 questions remaining. 5 seconds remaining. Okay, so we're done with 20 questions. Attendees, 10 questions are remaining. So 21 question. Question number 21 on your screen.
So which of the following medications is contraindicated in patients with seizures? Option A, dalfampridine. Option B, fingolimod. Option C, natalizumab. Or option D, teriflunomide.
5 seconds remaining.
So CAMS 223 trial compares option A alemtuzumab with interferon beta 1A, option B ocrelizumab with interferon beta 1A, option C ofatumab with interferon beta 1A, or option D ofatumab with teriflunomide.
5 seconds remaining.
The patient presents with painless vision loss in one eye. He is found to have a centrocecal scotoma in that eye. His mother and brother experienced similar symptoms and eventually lost vision in both the eyes. The patient's MRI brain is normal. What is the most likely diagnosis? Option A, optic neuritis. Option B, Leber's hereditary optic neuropathy. Option C, myotonic dystrophy. Or option D, oculopharyngeal muscular dystrophy.
5 seconds remaining. Question 24 onwards.
So all are anti-CD20 monoclonal antibodies except option A, obinutuzumab, option B, ofatumab, option C, DIV4, or option D, ocrelizumab.
Five seconds remaining. Question number 25.
So what is the mechanism of action of natalizumab? Option A, it is a sphingosine 1-phosphate receptor agonist. Option B, it interferes with the interaction between very late antigen 4 and vascular endothelial adhesion molecule 1. Option C, it is anti-CD20 molecule. Or option D, it inhibits dihydroorotate dehydrogenase.
Attendees, you have 5 seconds remaining. We'll be done with 25 questions. Remaining 5 questions is remaining. We will start with 26. Okay.
So the next question, which of the enlisted neuroinfections is known to cause this kind of radiological presentation which mimics CNS demyelination? Option A, cryptococcosis. Option B, toxoplasmosis. Option C, listeriosis. Or option D, it's a John Cunningham virus.
5 seconds remaining. Question number 27 on your screen.
So all are correct matches except Ultimate 1 and 2 trial for obinutuzumab. Option B, Octopus trial for ocrelizumab. Option C, CARE-MS 1 and 2 trial for alemtuzumab. Or option D, CAMS 2 to 3 trial for alemtuzumab. So all are correct match except you have to mark.
5 seconds remaining. Question number 28 on your screen.
So to identify this logo represents which organization? Option A, ECTRIMS. Option B, MS International Federation. Option C, National MS Society, US. Or option D, MS Society, UK.
5 seconds remaining. Question number 29.
So CAR T cell therapy, all are true except option A, it is genetically modifying a patient's own T cell to target and destroy the B cells in body. Option B, recognizing and binding to a protein called CD19. Option C, the therapy is not permeable to blood-brain barrier. Or option D, phase 1 trial is ongoing.
5 seconds remaining.
Last question.
Yes. Question number 30. This is the last question of this quiz on your screen.
So you have to identify this researcher who is credited with the landmark discovery of aquaporin 4 autoantibody. It led to the reclassification of subset of inflammatory CNS disorder as a distinct astrocytopathy in 2004. So you have to identify the researcher and mark it. Who is she?
Five seconds remaining. Okay, we're done with the quiz. All 30 questions done.
So we thank you all for participation. You will be receiving the results soon. We wish you all the best.
Yeah. Thanks.
See you at the final lectures.
Yes, I think we can close the session. No?
Thank you all.
Yes, you can.
Thank you all.
Thank you so much.